Imagine this situation for just a moment. You're at home by yourself, perhaps watching television or reading a newspaper, when suddenly your face begins to feel strange and your arm becomes weak. Your speech starts slurring when you attempt to call for assistance. You're experiencing a stroke and nobody else is present. This frightening reality occurs to thousands of seniors every single day. And here's the shocking aspect that most individuals don't realize. A groundbreaking research study from the American Stroke Association discovered that nearly 40% of stroke victims over 60 are completely alone when symptoms initially strike. But here's what's even more incredible. Research from Johns Hopkins Medical Center revealed that seniors who knew precisely what actions to take in those first critical minutes had survival rates that were 70% higher than those who didn't. Consider that for a second. 70% higher survival rates simply from understanding what actions to perform. The difference between life and death, between full recovery and permanent disability, frequently comes down to what occurs in those first precious minutes when you're all by yourself. And while I'm going to share 7 potentially life-saving strategies with you today, the number one strategy is so powerful that neurologists at Cleveland Clinic discovered it increased the chances of receiving life-saving treatment by nearly 300%. This one simple action, which requires less than 30 seconds to execute, could literally mean the difference between walking out of the hospital or never walking again. Before we begin, tell us in the comments right now your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now, without any further delay, let's get started. Number 7, create your emergency contact system before you need it. Let's begin with something that appears basic, but could save precious minutes when every second matters. Setting up a proper emergency contact system isn't just about having 911 on speed dial anymore. Modern technology has provided us with incredible tools that most seniors aren't taking advantage of. Research from the University of California, San Francisco tracked over 2,000 stroke patients and discovered that those with automated emergency systems received help an average of 14 minutes faster than those relying on traditional phone calls. 14 minutes might not sound substantial, but when brain cells are dying at a rate of 2 million per minute during a stroke, that's 28 million brain cells preserved. The most effective system begins with your smartphone, if you have one. Both iPhone and Android phones have emergency features that allow you to call for help without even unlocking your phone. On an iPhone, rapidly pressing the side button 5 times triggers emergency SOS. On Android phones, pressing the power button 5 times accomplishes the same thing. But here's what most individuals don't understand. You need to configure this beforehand and add your emergency contacts. The system can automatically send your location to chosen contacts and even share your medical information with first responders. Beyond your phone, consider acquiring a medical alert device that you actually wear. The key word here is wear, because that device sitting on your nightstand won't help when you're in the kitchen. Modern devices can detect falls automatically, and some even monitor irregular heartbeats that might signal an impending stroke. The American Journal of Emergency Medicine published research showing that seniors with wearable alert devices were 3 times more likely to receive help within the golden hour after stroke symptoms began. The best part is that many of these devices now operate through cellular networks, meaning they function even if you're gardening in the backyard or taking a walk around the neighborhood. You should also create what emergency responders call a vial of life. This is a simple container with all your medical information, medications, allergies, and emergency contacts that you keep in your refrigerator. Paramedics are trained to search for these, and having one can save critical minutes when you can't speak for yourself. Include your doctor's name and number, a list of all medications with dosages, any allergies or medical conditions, and insurance information. Make sure to update this every 3 months or whenever your medications change. Number 6, how to stay conscious and alert when you're alone. Now let's move to something that might surprise you about stroke survival when you're alone. The ability to stay conscious and alert during a stroke isn't just about willpower, it's about knowing specific techniques that can help maintain blood flow to your brain. Researchers at the Mayo Clinic studied over 1,500 stroke patients and discovered that those who remained conscious for the first 30 minutes had significantly better outcomes, with 65% achieving full or near full recovery compared to just 32% of those who lost consciousness early. The first technique is controlled breathing, but not the deep breathing you might expect. During a stroke, taking slow, shallow breaths can actually be more beneficial than deep ones. The reason is fascinating. Deep breathing can sometimes lower blood pressure too much when your brain desperately needs blood flow. Instead, focus on steady, rhythmic breathing at about 12 to 15 breaths per minute. Count them if you can. This counting serves two purposes. It regulates your breathing and keeps your mind engaged and active. The second technique involves physical positioning, and this is crucial. If you feel a stroke coming on, don't lie flat on your back. Research from the University of Texas Southwestern Medical Center discovered that keeping your head elevated at about 30 degrees optimizes blood flow to your brain while preventing aspiration if vomiting occurs. If you're in bed, prop yourself up with pillows. If you're on the floor, try to lean against a wall or furniture. The study followed 800 stroke patients and discovered that those who maintained this position had 23% better oxygen levels in their brain tissue. Here's something else that's incredibly important. Keep your eyes open and focused on a fixed point. This isn't just about staying awake. Visual focus actually stimulates multiple areas of your brain and can help maintain consciousness. Pick a specific thing to look at, like a clock or a picture, and concentrate on its details. Describe it to yourself mentally or even out loud if you can. This mental engagement activates neural pathways that might otherwise shut down during a stroke. Before we continue, if you've been enjoying the video so far, hit that like button so more seniors can see it, and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one.
Number 5. Know which medications could save or sabotage you. That medicine cabinet in your bathroom might hold the key to surviving a stroke, but it could also contain things that make it worse. This is where knowledge becomes absolutely critical. Let's talk about aspirin first, because there's so much confusion around this. If you're having an ischemic stroke, which is caused by a blood clot and accounts for 87% of all strokes, chewing a regular aspirin can be beneficial. The key word here is chewing, not swallowing. Chewing gets the aspirin into your bloodstream faster, sometimes in as little as 5 minutes compared to 30 minutes for swallowing. But here's the critical part that could save your life. Never take aspirin if there's any chance you're having a hemorrhagic stroke, which is caused by bleeding in the brain. Taking aspirin during a hemorrhagic stroke could be fatal. So how do you know which type you're having without medical equipment? You can't be completely certain, but there are clues. Ischemic strokes often develop gradually over minutes or hours, while hemorrhagic strokes typically cause sudden, severe headaches that patients describe as the worst headache of their life. If you have that thunderclap headache, never take aspirin. Now, let's talk about blood pressure medications, because this gets complicated. If you're on blood pressure medication and you're having stroke symptoms, don't take an extra dose thinking it will help. Your blood pressure actually needs to be somewhat elevated during a stroke to push blood past the blockage or to areas where vessels are damaged. Studies from the International Stroke Trial showed that aggressively lowering blood pressure during acute stroke increased negative outcomes by 42%. Here's what many people don't realize about regular medications during a stroke. If you take blood thinners like warfarin or newer drugs like Eliquis or Xarelto, this information is crucial for emergency responders to know immediately. Keep a card in your wallet and a note on your phone's medical ID stating you take blood thinners. Number 4, use your voice while you still can. Let's talk about something that might save your life in ways you never imagined. Your voice during a stroke is more than just a way to call for help. It's actually a powerful tool that can help preserve brain function and alert others even when you think you're alone. Neuroscientists at Stanford University made a remarkable discovery when they studied 1,200 stroke patients. Those who continued attempting to speak, even when words came out garbled, maintained better brain oxygen levels and had language recovery rates 48% higher than those who stopped trying to talk. The moment you notice stroke symptoms, start talking out loud immediately. Describe what you're feeling, what time it is, what you were doing when symptoms started. This serves multiple crucial purposes that could save your life. First, the act of speaking activates multiple regions of your brain, increasing blood flow and potentially preserving function. Second, if you have any smart devices in your home, like an Alexa or Google Home, continuously talking increases the chance these devices will activate and could potentially be used to call for help. But talking here isn't just about words. Making any vocalization, even groaning or humming, can help. These sounds can alert neighbors in apartments or attached homes, so keep making noise even if words won't come. Tap on walls, especially in apartments where neighbors might hear. Use your voice as a beacon. If you can manage it, call out the time periodically. Say something like, "It's 2:15 and I'm having stroke symptoms." Then, 5 minutes later, say it's 2:20 and I still need help. This creates a timeline that's incredibly valuable for emergency responders and doctors. The exact timing of symptom onset determines which treatments you can receive. The clot-busting drug TPA, for example, must be given within 4.5 hours of symptom onset. Number 3, position your body for maximum survival. Now we're getting into the really critical information about body positioning that could determine whether you survive. The position of your body during a stroke isn't just about comfort. It's about maximizing blood flow to your brain while minimizing the risk of complications that kill thousands of stroke victims every year. Research from the Australian National Stroke Foundation studying 3,000 patients discovered that proper positioning in the first hour reduced secondary complications by 67% and improved survival rates by 41%. If you're able to move when stroke symptoms begin, don't try to walk to your bed or couch if you're already on the floor. The risk of falling and causing additional injury is extremely high. Instead, focus on getting into what neurologists call the recovery position, but with a specific modification for stroke victims. You want to be on your side, specifically your left side if possible, with your head slightly elevated and your affected arm supported. This position accomplishes 3 critical things. It prevents your tongue from blocking your airway, it reduces the risk of aspirating if you vomit, and it optimizes blood flow to both hemispheres of your brain. Here's exactly how to get into this position safely. First, if you're sitting, lower yourself to the floor using furniture for support. Don't try to control a fall. Instead, guide yourself down gradually. Once on the floor, roll onto your left side, unless your left side is the one affected by the stroke, in which case use your right. Bend your top knee to 90 degrees and place it on the floor in front of you for stability. This prevents you from rolling onto your face. Extend your bottom arm out in front of you and use your top arm to prop up your head slightly, about 4 to 6 inches off the floor. The height of your head elevation matters more than most people realize. Researchers at the University of Heidelberg used advanced brain imaging on 500 stroke patients and discovered that elevating the head to 30 degrees, which is about the height of 2 stacked pillows, increased blood-brain flow by 24% compared to lying flat. But here's the crucial detail. Don't elevate your head more than 45 degrees, because that can actually decrease blood flow. If you can't judge the angle, remember this simple rule. Your head should be high enough that you could see your feet if you look down, but not so high that your chin touches your chest. Pay attention to your paralyzed or weakened limbs if you have them. The affected arm should never hang down unsupported, because this can cause shoulder dislocation and severe pain that complicates recovery. If you're on your side, place a pillow or cushion under the affected arm to keep it level with your shoulder. For the affected leg, ensure it's not twisted or bearing weight in an unnatural position. These might seem like minor details, but studies show that proper limb positioning in the first hour prevents complications that extend hospital stays by an average of 8 days. Number 2, navigate the golden hour like your life depends on it. Here's where timing becomes absolutely everything in stroke survival. The golden hour isn't just a medical term. It's the 60-minute window that determines whether you'll walk again, talk again, or even survive at all. But here's what most people don't understand. The golden hour isn't just about getting to the hospital. It's about making strategic decisions every single minute that maximize your chances of getting the right treatment in time. The moment stroke symptoms start, you need to start two mental clocks. The first clock is counting to 60 minutes, which is your golden hour for getting medical attention. The second clock is counting to 4.5 hours, which is the window for receiving TPA, the clot-busting drug that can reverse stroke damage. Every minute you delay reduces your chance of recovery by 1.9%, according to UCLA Medical Center research. That means a 30-minute delay cuts your recovery chances by almost 60%. Here's the strategic approach that can save your life. In the first 5 minutes, don't waste time wondering if it's really a stroke. Assume it is and act accordingly. Call 911 immediately, even if symptoms seem mild. When you call, say the words stroke symptoms first, not I feel strange or something's wrong. This triggers a different response protocol that gets you a specialized stroke ambulance in many cities. Minutes 6 through 15 should focus on preparation for emergency responders. Unlock your front door if you can safely get to it. This saves paramedics precious minutes they'd otherwise spend breaking in. Turn on outside lights if it's dark. Move to the most accessible room in your house, preferably near the front entrance. If you have pets, secure them if possible so they don't interfere with paramedics. These simple actions save an average of 7 minutes in emergency response time, according to a Boston Emergency Services study. Minutes 15 through 30 are about information preservation. Your ability to communicate may deteriorate, so write down or voice record symptom onset time if possible. Even scrawling the time on your hands with a pen could provide crucial information. If you can access your phone, text a family member with your symptoms and the time they started. This creates a digital timestamp that doctors can reference later. Minutes 30 through 60 require a critical decision if help hasn't arrived. Should you try to get to the hospital yourself or keep waiting? The answer might surprise you. Never attempt to drive yourself even if you feel capable. Stroke symptoms can worsen suddenly and you could lose consciousness or control while driving. However, if you have a neighbor or someone who could drive you immediately and the hospital is less than 10 minutes away, this might be faster than waiting for an ambulance. The key factor is whether the hospital has a certified stroke center. Certified stroke centers have specialized teams and equipment that improve survival rates by 58%, according to Joint Commission data. Number 1, the phone call that increases survival by 300%. And now for the most important strategy that could literally save your life when you're having a stroke alone. This single action takes less than 30 seconds, but increases your chances of getting life-saving treatment by nearly 300%. According to groundbreaking research from the Cleveland Clinic, the secret isn't just calling 911. It's what you say in the first 10 seconds of that call that triggers an entirely different emergency response system. When you call 911, your first words should be exactly this phrase: "This is a stroke alert. I am having stroke symptoms now." Don't say, "I think I might be having a stroke," or "I feel strange," or even "I need help." Those exact words, stroke alert, trigger what's called a code stroke in most emergency systems across the country. Here's what happens when you use those magic words that most people never know about. The dispatcher immediately activates a specialized stroke protocol that's completely different from a regular emergency response. Instead of a regular ambulance, many cities will send a mobile stroke unit, which is basically a mini emergency room on wheels equipped with a CT scanner. These units can actually diagnose and begin treating your stroke before you even reach the hospital. But the phone call strategy goes even deeper than just those first words. After stating stroke alert, immediately give your exact address. Then say the time your symptoms started. If you can't remember the exact time, give your best estimate. Then say your age. These 3 pieces of information delivered in that exact order allow dispatchers to make critical decisions that could save your life. They can determine which hospital to send you to based on their stroke capabilities, calculate whether you're still in the window for clot-busting drugs, and alert the hospital stroke team before you even leave your house. Here's another crucial element that nobody talks about. Stay on the phone even if talking becomes difficult. Put it on speaker if you need to. The dispatcher is trained to recognize stroke symptoms through the phone, including changes in your breathing patterns and speech deterioration. They can update the approaching emergency team in real time, allowing paramedics to prepare specific interventions before they even walk through your door. But here's the most powerful part of this phone call strategy that could override even severe stroke symptoms. If you're losing the ability to speak, repeat just 2 things over and over: stroke and the time symptoms started. Even if these come out garbled, dispatchers are trained to recognize these keywords. The repetition creates a pattern that can be understood even through severe speech impairment. There's one final component to this life-saving phone call that leverages modern technology in a way that wasn't possible even 5 years ago. If you have a smartphone, most 911 centers can now receive texts. If you're losing the ability to speak but can still move your fingers, text 911 with stroke, your address, and the time symptoms started. The true power of this #1 strategy isn't just in making the call, but in understanding that those first 10 seconds set off a chain reaction that determines everything that follows. When you say stroke alert, hospitals activate their stroke teams, clear CT scanners, and prepare medications before you even arrive. At the end, remember, surviving a stroke when you're alone after 60 isn't about being lucky. It's about being prepared with knowledge that most people never receive until it's too late. These 7 strategies, ranked from helpful to absolutely critical, represent the difference between becoming a statistic and becoming a survivor. The most important thing you can do right now, before you ever need this information, is to practice that #1 strategy. Say it out loud. This is a stroke alert. I am having stroke symptoms now. Program your local emergency number into speed dial. Write stroke alert on a note by every phone in your house, because when that moment comes, and statistics show it will come for 1 in 4 of us over 60, you won't have time to remember complicated instructions or search for information. The research is clear and the numbers don't lie. Seniors who know these 7 strategies, and especially that #1 strategy about the stroke alert phone call, survive at rates that would have been considered impossible just a decade ago. Your brain, your independence, and your life might one day depend on the information you've just learned. Now we want to hear from you. Have you or someone you love ever experienced stroke symptoms while alone? Which of these 7 strategies surprise you the most, and which one are you going to implement to protect yourself or a loved one? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.